Improving the medical response to a mass shooting, that's been the focus of top trauma surgeons who just released a list of recommendations. Now, the study's co-author and assistant dean for research and professor of surgery at Kirk Kerkorian School of Medicine here in town, Dr. Deborah Kuhls, joins us now. You led the medical response to 1 October, and what compelled you to want to do this follow-up response?
So following 1 October, I think we really did an after-action analysis of what went well, what could do better, and there's always room for improvement and the ability to share our experience to help other hospitals, other healthcare professionals be really ready in case this happens in their neighborhood or their hospital.
And that makes good sense. I know that our state, one of 6 involved in this conference, and invite of clinicians to take part. And what were some of the key takeaways?
So there were a total of 19 recommendations.
Okay.
I think they fall into several categories. One is train and train and train. And train even healthcare professionals that don't normally take care of injured patients. Also triage or sort patients, particularly from a mass casualty from shooting. There's a higher likelihood of needing blood and needing the operating room. So for instance, when patients reach a hospital, to set a triage area outside of the hospital and to very quickly sort patients about who needs blood, who needs life-saving operation, get those people into the hospital sooner than other people who are less injured. Other takeaways would be provide additional mental health for the healthcare workers, because it's traumatic also for the healthcare workers. If there's the ability to have a nearby military installation, a military-civilian partnership is very helpful, and to encourage those. And in our case here in Las Vegas, our relationship with Nellis Air Force Base was extremely helpful.
So those are 5 out of the 19
Correct.
Recommendations.
Yes.
I know this was a response to when victims wind up in the hospital, but you also talk about a very important training prior to that part, the public training of stopping the bleed.
Absolutely. Because mass shootings, any other sort of mass casualty can happen without notice in any location. So it's really important for the public to understand what they can do. And in our own shooting, there were many, many valiant acts to try to save lives. Stop the Bleed training actually was introduced by the American College of Surgeons after the Sandy Hook shooting. And it teaches basic principles of hemorrhage control, how to apply a tourniquet adequately if you don't have one, what else you can use, and how to apply pressure to a bleeding wound. These maneuvers can save lives.
Yep, and we've had plenty of those trainings across our valley, and you can always go online to find the next one nearest you if you would like to become trained in that way as well. Dr. Kuhls, thank you so much for your time. We greatly appreciate that.
You're very welcome.